Good afternoon, everyone, and welcome. My name is Kristen Weavers, and I serve as the Senior Vice President and Chief Marketing and Communications Officer at UC Health here in Cincinnati, Ohio. We are here at the request of the Warmbier family to provide an update on Otto's medical condition and the care he is currently receiving at UC Health's University of Cincinnati Medical Center. Today, you will hear from the following physicians: Dr. Daniel Cantor, Director of the Neurocritical Care Program and the UC Gardner Neuroscience Institute and UC Professor of Neurology and Rehabilitation Medicine. Dr. Jordan Bonomo, Neurointensivist with the UC Gardner Science Neuro Institute, UC Associate Professor and Director of the UC Department of Emergency Medicine's Division of Critical Care. And Dr. Brandon Foreman, Neurointensive Care Specialist with the UC Gardner Neuroscience Institute and UC Professor of Neurology and Rehabilitation Medicine. Before we begin, we want to make clear that our physicians' comments will focus on what we know today regarding Otto's medical condition. We will begin with Dr. Cantor, who will provide a summary. We will then accept questions regarding and we'll conclude this gathering in approximately 20 minutes. At that time, we will then accept questions regarding fact-checking, and you can talk with Kelly Martin, who is down in front here, regarding any facts or information contained in the press materials you've received. Please note, our physicians will not be granting individual interviews, and a copy of Dr. Cantor's remarks will be provided to you as you exit today. Dr. Cantor.
Good afternoon. Our purpose today is to describe the medical and neurological condition of Mr. Otto Warmbier, who arrived at our medical center approximately 40 hours ago. The Warmbier family has given us permission and has asked us to disclose his current medical condition. Mr. Warmbier arrived in Cincinnati at approximately 10 p.m. on June 13th. Dr. Jordan Bonomo and the transport team met the aircraft and assumed care of the patient at the airport. He was transported to the Neuroscience Intensive Care Unit at the University of Cincinnati Medical Center, where Dr. Brandon Foreman and his team were waiting. An extensive series of imaging and diagnostic tests began immediately upon his arrival at our hospital. Throughout this process, the Warmbier family has been at their son's bedside, and information has been continuously shared with them. His vital signs were stable upon arrival and have remained so. He requires no supplemental oxygen or respiratory assistance. He has no signs of infection or dysfunction of the major non-neurological organs. His neurological condition can be best described as a state of unresponsive wakefulness. He has spontaneous eye opening and blinking. However, he shows no signs of understanding language, responding to verbal commands, or awareness of his surroundings. He has not spoken. He has not engaged in any purposeful movements or behaviors. His exam shows a spastic quadriparesis, which means he has profound weakness and contraction of the muscles of his arms and legs. The most important diagnostic test thus far was a magnetic resonance imaging scan of the brain. This study showed extensive loss of brain tissue in all regions of the brain. We have no certain or verifiable knowledge of the cause or circumstances of his neurological injury. This pattern of brain injury, however, is usually seen as a result of cardiopulmonary arrest, where the blood supply to the brain is inadequate for a period of time, resulting in the death of brain tissue. We received copies of brain MRI images from the medical personnel in North Korea. The earliest images are dated April 2016. Based upon our analysis of those images, the brain injury likely occurred in the preceding weeks. At the request of the family, information regarding his prognosis, prospects for improvement, and future care and treatment will remain confidential. Throughout this ordeal, the Warmbier family has shown remarkable courage, strength, and compassion. On behalf of the medical staff, nurses, and associates of the University of Cincinnati Medical Center, I can say that it is our privilege to care for their son and brother. Thank you.
At this time, we will accept questions. Please raise your hand, and Kelly Martin, to my left, your right, will acknowledge you and bring a microphone to you so that everyone may hear your question.
Hi there, Josh Clancy from the Sunday Times of London. You spoke about cardiopulmonary arrest. What kind of things might cause cardiopulmonary arrest? I mean, because it sounds to me like, you know, physical abuse might be something that could bring that on. Could you say a little more about that?
We have no certain or verifiable information about what happened to Otto prior to his departure from North Korea. But in general terms, one of the more likely causes of a cardiopulmonary arrest in a young person would have been a respiratory arrest.
Hi, Miguel Marquez from CNN. On your MRI and scans that you did of Mr. Warmbier, was there any indication of trauma to any part of him? Were there any fractures, anything in the head or other parts of the body? And would you know if he were in a coma for quite some time, if he had suffered a heart attack or something that would cut off blood supply to the brain? Would you be able to tell at this point that he suffered botulism, took a sleeping pill, had some other cause, some allergic reaction or some sort of reaction to something he took there?
Well, there's several questions put together there. Dr. Foreman will address the botulism question. Let me address the question of injuries. Among the battery of tests we performed, we examined all the long bones of the body, a skeletal survey. We've looked at the bony structures of the ribs, the pelvis, the skull, and he's had CT scans of the chest, abdomen, and pelvis. In those scans, we see no evidence of an acute or healing fracture, including the skull. The botulism question.
Yeah, as it relates to botulism, so botulism, as you know, it's a toxin that causes nerve injury. And so as part of his evaluation with us, we performed electromyography and nerve conduction studies. Those tests did not reveal any evidence of active or chronic denervation, nor any repetitive stimulation that would suggest active botulism at this time. It tends not to, and so the chronic denervation was really what we were looking for. We didn't find any evidence of that.
Oh, excuse me. Please raise your hand,
Cheryl Stolberg of the New York Times. Can you talk about how long a patient in this kind of condition might be expected to go on?
At the request of the family, issues regarding his future, his prognosis, are a subject of ongoing discussion. They wish us to keep those discussions private and confidential. So we will refrain from speculating about what might happen in the future to him. It would overlap with our private discussions with the family too much.
Ron Mott, NBC News. I'm wondering, you spoke a little bit about botulism. In your professional opinions, what's the likelihood or the plausibility of the story put forward by the North Koreans that botulism plus a sleeping pill led to this result? Have there been cases similar to this where that particular combination, it seems very rare and sort of random? I just wanted to get your professional opinion about the plausibility of that explanation from the North Koreans.
It would be really hard to speculate on anything related to his condition or treatment prior to his departure from North Korea at this time. It would be very difficult for us to say. We have limited information about that time period.
Christina Corbin, Fox News. I just wanted to clarify, Dr. Foreman, you say you didn't find any evidence whatsoever of botulism at all?
That's correct, yeah.
Okay.
Mm-hmm.
Sorry, Lindsay Janis, ABC News. You said something about a respiratory arrest. What would trigger that?
There are many causes of respiratory arrest. They can stem from intoxication to trauma. There can be other causes in a young person, but in general, respiratory arrest in a young, otherwise healthy person, it's a rare event and generally caused by something like an intoxication or a traumatic injury.
John Vidal with WHIO-TV in Dayton. For any three of you, what Otto has suffered in his brain, are we talking irreversible damage? Can he recover from this? What is his brain going through, or will it go through long term?
Well, as I delineated, there's severe injury to all regions of the brain, but because of the family sensitivity, we are going to refrain from discussing what that holds, the future holds for him.
Ann Saker from the Cincinnati Enquirer. Given his condition, can you tell if he's been given good care for the last year plus since he's been in this condition?
We still, of course, don't know for sure what transpired before he arrived. We can describe his condition upon arrival. His skin was in good condition, and he was well nourished when he arrived at our facility.
Amanda Kelly at WLWT. I was wondering how difficult it is for all of you to treat a patient that has such a gap in his medical history. I know that that's very important when anyone goes to the doctors. What's it been like for you?
Yeah, that's been certainly that's been a challenge. I think one of the things that we did well as part of his care team is we really performed a very comprehensive set of evaluations and diagnostics up front within the first 24 hours. We had a great deal of information that allowed us to make a lot of inferences about his condition. And so by working with such a great team, I think we had a lot of information that we weren't able to get with the missing records and missing information that you point out.
Relationship. These scans were present on a disc of material, and they came with them with the air transport service. There are 2 scans on the disc. They are dated April and July 2016. That's the notation. Of course, we can't verify that. His current scan is consistent with evolution of changes that were visible on those scans. The word extensive in his case refers to severe loss of tissue. Sure. So the final common pathway is the lack of blood flow to the brain for long enough to destroy brain cells. This can occur from a cardiac arrest alone, where the heart stops pumping blood, or from a respiratory arrest where there's inadequate oxygen supplied to the body, at which point then the heart will stop functioning correctly. It's difficult to determine which of those occurred, of course.
And how does it work? I'm sorry, Miguel from CNN. How does it work? So if one suffers that sort of event where the blood stops flowing to the brain, is the damage done all at once, or what was that evolution of change that you saw from March to July, and then presently what we have? Did it get progressively worse, or was this all the damage done in one go?
The evolving changes on the MRI are consistent with tissue evolution, not new damage. So as the tissue is initially damaged, the body tries to remove the damaged tissue. So those are the kind of changes we're seeing, is the removal of the damaged tissue by the body's own internal housekeeping mechanisms. But the damage to the brain from a cardiopulmonary arrest occurs within minutes of inadequate blood flow. And do you want to comment?
We do see respiratory arrest from overdose, from medication overdose, intentional and otherwise. It would be inappropriate for me to speculate about the intent or whether this was a misadministration of a medication. Again, we have very limited information about what happened to Otto prior to his departure from North Korea.
Two quick questions here. One, Mr. Warmbier at his press conference today criticized the North Korean regime about withholding top-notch medical care from their son. I just wanted to get your opinions about whether in this ordeal you think he has had access to top-notch medical care. And then the second question, the term you mentioned, unresponsive wakefulness, that he does have some eye movement from time to time. Can you tell if there is any recognition on his part about his surroundings?
I can take both of those. So in terms of his medical care in North Korea, we have absolutely no information about the care that he received there. So there's no way I can speculate on his care there. What I can tell you is here we've really taken a lot of effort to make sure we've addressed any problems that he may be having, including his comfort, including symptoms related to the extensiveness of his brain injury. With regard to the state of unresponsive wakefulness that he is currently in, the way that we evaluate him to be able to determine that is based on a lack of consistent and persistent responses to stimulation within his environment. So as we attempt to interact with him, give him verbal direction or verbal cues, he has no consistent responses to those. In our evaluation, based on standard coma recovery scale scores and those sorts of things, in addition to our imaging and electrodiagnostics, we don't feel at this time that he has any conscious awareness that he is in this persistent, in this unresponsive wakefulness state.
Sorry, just one follow-up. Were the scans that you got from the North Koreans the entirety of everything you got from them? Were there any other files? And are there any signs of choking or drowning or anything else to the soft tissue that you might be able to tell from the scans you've done?
I can take So there was a CT scan of the soft tissues of the neck performed as part of our extensive series of tests. At the present time, the study looks normal. We did receive a few pages of laboratory value reports from North Korea, which are numerical values of various blood tests with dates. They did not, however, shed light on the circumstances of his injury or the exact cause.
Ann Thompson, WVXU here in Cincinnati. So, of course, the speculation was that he was badly beaten. So what, if any, evidence did you see on the MRI of any injuries, trauma like that?
The MRI, as I said previously, the type and pattern of damage we see on the MRI is not the type we normally see with traumatic brain injury. It's the type we normally see with cardiopulmonary arrest.
Thanks. Dake Kang from the Associated Press.
Just wanted to ask, I mean, it sounds like there's various kinds of information. I know it's patchy, but from the North Koreans, including these blood tests, these discs with the scans. I wanted to know if there was anything, like everything and anything that they might have told you, any kind of information, any kind of, all kinds of files. What did they tell you? What's the totality of what they told you? What kind of information you received from them?
We've had no direct contact with the North Korean medical authorities.
We're going to take 2 more questions, and then we will conclude.
Can there be any more tests
Could you introduce yourself, please?
Sorry, Amanda at Channel 5 again. Are there more tests that you've had them here for about 40 hours? Is there more that can be learned over time, or have you guys essentially done the battery of tests and essentially this is what we know, and as far as we will get and have to wait?
Yeah, you know, we wanted to perform a complete evaluation for his current state, and so that's those tests have been done at this time. I think we have a fairly complete view of his current state. Further tests down the line, you know, at this point are going to rely on decision-making and prognostic discussions with the family, which, as we've said, are private at this time.
So Cheryl Stolberg of the New York Times again. American intelligence officials have said that he was singled out for particularly brutal beatings. And so I'm wondering, did he show any body scars, or is it your opinion that he was not beaten?
As I said, there were no fractures of the bones that we can detect, and there were minor blemishes on his skin that are thought to be consistent with medical care and intravenous lines. We did not see any skin indications that are strongly suggestive of mistreatment. But beyond that, we cannot speculate on what might have occurred in the past.
Thank you. We value our media partners to share this story accurately. Thank you, Dr. Cantor, Dr. Botomo, Dr. Foreman. On behalf of UC Health, we echo Dr. Cantor's comment. It has truly been our privilege to care for Otto. Thank you very much, and good afternoon.